That was U.S. Vice President Mike Pence speaking there. Let's cross now to Dr. William Schaffner. He is a professor of preventative medicine at Vanderbilt University Medical Center in the state of Tennessee in Nashville. Doctor, it's good to see you again. So we've got U.S. Vice President Mike Pence. He's leading the White House Coronavirus Task Force. A lot of people around the world have been perplexed by that. How do you feel, you as a medical professional, how do you feel about a politician with no medical training heading this task force?
Well, Brent, I think the good news is that he has surrounded himself with absolutely solid professional persons from the CDC and from the National Institutes of Health. So I think he's getting very, very solid advice.
Pence has told the American public that the risk to the average American from the virus remains low. Do you agree with that?
Yes, I do. I do agree with that. But you have to be careful to not just walk on the sunny side of the street. We still don't know the exact extent of the coronavirus across the United States because we haven't been doing sufficient testing. That's just beginning to resolve itself. But the estimates of how many people will be tested have been, that we've heard in the last several days, have been overly generous. Most of us as professionals know this is going to roll out much more slowly.
Yeah, I mean, it's rolling out slowly. Pence says the U.S. does not have enough coronavirus tests to meet the anticipated demand. When you put all that together, shouldn't the public be worried?
Well, I think the public ought to be observant and watch what's happening. I know the professionals are working very hard to roll out these tests so that every state laboratory will have testing capacity. And then furthermore, private laboratories are getting their tests submitted to the Food and Drug Administration for approval. They will be coming online also gradually in the next couple of 3 weeks. And once that happens, we'll have a much larger testing capacity. And we'll need to see whether coronavirus is widespread in the United States or whether it's focal here and there.
You know, here in Europe, we've had somewhat of more leadway than you've had in the United States in watching this crisis. We've seen what happened in China and Asia, and then we saw what happened here in Europe with Italy, and now we see what's happening in the United States. Do you think that Americans have been adequately informed about basic measures that they can undertake to prevent the spread of the coronavirus?
I think the communication about those basic measures has been pretty clear, and I think it has been well received because we increasingly learn about people who are considering or reconsidering large meetings and such, and whether they need to be held. Is travel really essential? Hand sanitizers can't be bought anymore because they're off the shelves of all the supermarkets. So people are getting the word about what it is that they can do to protect themselves and their families.
Yeah, we have the same situation here. It's impossible to buy hand sanitizer right now here in Berlin. Let me ask you about the healthcare system, the insurance system in the United States. Here in Europe, when we look at the United States, we're always concerned about the risks that are posed by a system where you have millions of people in the U.S. without medical insurance. Could that be a problem when trying to stop this virus from spreading?
Oh, sure, that could be a problem. Obviously, all hospitals are obliged to provide charity care, but that's still kind of a shaky foundation. What we hope is that the new monies that are going to be appropriated by the Congress and this administration, some of that will go to clinical care of patients who don't have medical insurance. That will reassure everyone.
And before we run out of time, Doctor, a vaccine. We've heard that the earliest we can expect one to come out of trials and to actually go onto the market would be the beginning of next summer, late of spring next year. Is that the time horizon you're working with as well?
Well, I have my fingers crossed. If the scientific evaluation of the vaccine continues in a straight line and everything is successful, that will be an Olympic record for developing a vaccine but it will take that much time.
Okay, well, let's hope that we are Olympic champions then next year this time. Dr. William Schaffner joining us tonight from Vanderbilt University Medical Center in the state of Tennessee. Doctor, thank you. We appreciate your time tonight.
Auf Wiedersehen.